All right, we should be live. Welcome everybody to the Meet Our Scholars webinar series from Church Health. If you're just joining us, welcome. If you viewed some of the other episodes and webinars, that's great. Welcome back. Today we have with us our clinic assistant scholars, and so we'll be talking to Ben Rogers and Jasmine Williams and their supervisor, Tiffiny Wright. So before we do that, I'm Alan Lebo, and I'm the Workforce Development Coordinator at Church Health, and I run the Scholars Program along with a whole bunch of people in it and pretty much everybody on staff. We all kind of care for the scholars. And so we'll talk a little bit more about the program throughout this webinar, and toward the end I'll talk a little bit more about the application process, deadlines, and some good tips and tricks. And if we have any questions and you're joining us live today, please feel free and throw those in the chat. We'll be checking that throughout the day. And try to address all the questions toward the end of the hour. So with that, I'd like to invite our scholars to introduce themselves. So Jasmine, would you like to go first?
Yes, so I'm Jasmine Williams. I'm the first floor clinic scholar, and that is the internal medicine and urgent care department. So I pretty much just work on the first floor. I don't really have much interaction with the second floor, so I'll let Ben explain his duties.
Yeah, hey guys, my name is Ben, like Jasmine said. I'm the second floor scholar. I work mostly with family medicine, so that means basically what Jasmine sees, just we also see kids. And we also have a full residency program with 12 residents. And yeah, so that's always fun getting to talk to people who are going through and have already gone through what I'm about to go through. So it's pretty cool.
And I'm Tiffany Bright. I'm the nurse manager on the first floor and have had the privilege of being the manager on the first and second floors for most of the year this year. So I've been here for 10 years. I came here from many years of hospital work, and I'm a nurse, and a little bit of an interesting journey that I can share later in the interview, but one of my favorite things to do is to supervise these scholars. I've seen many reiterations of it over the years, and the program just continues to evolve better and better every year. So we can't survive without our scholars. We love our scholars, and I'm looking forward to whoever comes next year.
All right, thanks. Glad to have everybody here. I always like to start off a little bit just learning a little more about our scholars. So if you guys could talk a little bit about where you're from, where you guys plan on going, and what brought you here.
Yeah, I guess I can go first. So my name is Ben, like I said, I'm from Madison, Alabama. It's a small town right next to Huntsville, Alabama. If you're familiar with base camp, that's near me. Yeah, so after the scholars program, I plan on going to med school. I've been accepted to the University of Alabama at Birmingham, so I'll just like to be attending there. And then I came to Church Health just because I was an intern last year and really loved the message of what goes on at Church Health and all the cool things that go on here. And I was just like, I'd like to be a part of that in my gap year. So after I graduated in May 2020, I was lucky enough to be accepted as a scholar and came here and have loved it ever since.
Awesome, thanks, Ben. Jasmine, what about yourself?
Yes, and I'm from Memphis, Tennessee. I went to Middle Tennessee State University in Murfreesboro. I graduated August 2019. So I basically researched medical opportunities that was basically serving the underserved community. And somehow I discovered Church Health, and I did my research. I was like, this is something I would be interested in. I applied, and now I'm here. I plan to attend medical school next year. I'm currently still in the application process, so hopefully I'll get accepted. If not, I'm gonna apply again and keep the ball rolling. So that pretty much sums it up.
Yeah, thanks. So Ben and Jasmine, like many of our scholars, are both intending to apply to medical school, so they're on that journey and doing that while they're here, along with several other scholars. So I'd also like to invite Tiffany back to talk a little bit about you've been with Church Health, you've been a scholar supervisor for a while and got to know a lot of our scholars as they've come through Church Health, and then keeping those relationships as they leave. So I'd like to know what brought you to Church Health and what is your Church Health story?
So I came to Church Health from being a hospital nurse, and I just really wanted something different. and I saw the ad. I'm from Memphis, Tennessee. Somehow growing up in Memphis, I missed that Church Health was here. We've been here for 30 plus years and I didn't know about it. And so when I interviewed and found out about the mission of Church Health, which is serving people who, don't have access to health care and helping them in so many ways, I knew that this was a place for me. So I started out as a nurse for who then was our medical director. And I have to say, this is part of why the Scholar Program is so dear to my heart. I started at the end of April and didn't really know how to do primary care at all. All I knew were hospital type programs and processes. And so the scholars actually were really meaningful to me as we learned how to take care of patients. So in June, we had a new scholar join our team with me and Dr. Jennings. And so Joe and I really learned together that first year, and I got to watch Joe grow and learn more and more each day. The really interesting thing is that Joe Freeman actually finished his gap year, went to med school, and then was one of our first residency classes. So by that, I mean, a few years ago, we started a family practice residency program. And so in conjunction with Baptist, we have residents that operate in our clinic every day. And Joe was in that inaugural class. So I got to watch Joe be a scholar. I got to watch him come back through med school and shadow our providers. I got to watch Joe be a resident. And Joe still comes back and volunteers and sees our patients. That's just one scholar story. There's definitely a couple of others that I've watched, do the scholar program, and maybe not in the medical department, but in other departments, continue on with us for several years before moving on to another program or another position. So that is one reason I'm not answering the question that you asked me, but that is one reason that the scholar.
That's all right. This is great. This is great.
I've eventually became a charge nurse. Eventually we needed a nurse manager. So my position here has just continued to evolve, and I've really enjoyed every position that I've been able to do. My current position in management, I supervise medical assistants, I supervise scholars, farm techs, phone nurses. And my favorite part about scholar management is just watching them grow throughout the year. Being a scholar, you come here to learn a lot of different things. And you're coming from these strenuous programs. And so sometimes the knowledge that you're getting here isn't quite, it's not biochem, it's not calculus, it's not all of these crazy facts. But what you're learning at Church Health is how to interact with people, how to interact with physicians, how to have workplace relationships. It's all of these kind of interpersonal skills that you pick up, plus the relationships that you're able to build with our volunteer providers, our practicing physicians and nurse practitioners, and nurses and medical assistants. I'm one that believes you can learn from any person, whether it's a medical assistant, a nurse, or a doctor. So our scholars are given access to all of those people, along with a great program that Alan and others put together that's outside of the medical clinic. So that is why I love our scholar program. I'll support it year after year.
Thank you for that, Tiffany. I appreciate that. And I think, thank you for sharing, all of you. I think that's a really cool story that you bring up with Joe. And I know you say that that's one scholar's story, but Joe is also, his story is kind of what we hope to the scholar program to be. And so no pressure, you guys. But, I keep joking with the scholars, like, once you're here, we really don't let you go. We do consider our staff family, and our scholars are part of that. And so we always tell them, and we're probably jumping to the end of like, what is the whole point of the program, right? But it's okay, that's important, is we are hoping that you learn a little bit about our method of healthcare, our philosophy and our approach. And, it is coming from a faith-based place, but how does that fall into human connection, and how does that fit into our healthcare setting and how we deliver care and care for each other in our community? And so if scholars can get one piece of that and step out into the world, then that program is a success. Your time here was a success. And then what's better is, we don't let you leave. You know, Joe's coming back and volunteering. He was a resident. That's what we're really hoping for, is that we create that deep of a connection. So whether you are here or whether you go and you travel overseas, like some of our scholars have done, you are still putting that into practice, and that carries what we're trying to do forward in the bigger picture out into the world. And so really that is part of what the scholar cycle is. It doesn't actually stop. And so that's kind of cool and very meta, I'll admit. And so with that, I'd like to bring it back down into a little bit of a focus. Tiffany, I know you know I can go for hours on this, but yeah, Ben and Jasmine, I really want to hear from you guys. Can you describe on a more like day-to-day basis kind of what your role entails? Maybe describe like what your average week would look like. I know that's kind of hard, especially day-to-day being different, but if y'all could take a stab at that, I'd appreciate it.
Yes, so I think well, if Ben wants to go first, I'll let him. Okay, so I would say every day, well, first I want to say this year has been different with the pandemic, and I'm happy y'all have allowed us to still be a scholar, because I know a lot of internships and medical programs have, you know, canceled due to the coronavirus. So I would say it has been very different. I guess Ben and I have had the chance to work with the COVID drive-through testing. So that's Tuesday through Thursday, and it's very hands-on. I would also say we have had a lot of patient interactions with checking in, taking vitals, and basically shadowing and, well, I would like to say seeing minor surgeries every now and then. So that's a good bonus and plus. I have built relationships with the medical assistants, the nurses, physicians, and I enjoy learning and just being, you know, hands-on with everything.
Yeah, just echoing what Jasmine said. I think the best part about this job on a daily basis is there's really nothing that stays too much the same, which for me is great. Like, not to say that your whole life is just constantly going to be like, one day you're doing this, the next day you come in and you think you're doing, it's not that way. It's more things pop up and you're able to handle them. And I love that. I love problem solving, and I love the ability to, you know, just be able to do, you know, not just the same thing every day. So yeah, we do a lot of triaging, which is great because you get good at taking a patient history, a brief patient history, going through and triaging a patient, getting them ready to see the provider. Building that provider relationship is probably my favorite part of this job, because they really give you some great advice. And the coolest thing to me is on the second floor, we do a lot of procedures. So randomly a provider will walk up and be like, do you want to assist on this procedure? And I will always be like, yeah, of course, that's not even a question. Where are we? So that's really cool. You get to go in and assist on a procedure, be there helping, and also watching up close and personal what's going on, which sometimes isn't even the case when you're a med student or a resident. You're like, stand in that corner, don't touch anything, don't ruin my sterile field. Here, it's like you're a part of everything going on. And so that's really cool. So yeah, everything from procedures to rooming patients, running drive-through testing, like Jasmine said, getting to do random opportunities that pop up here and there. That's basically what being a scholar is. It's just going with the flow and having a great time.
I would pop in and say too that I always tell scholars at the beginning of the year that they're going to get what they put into this program. And Jasmine and Ben have been fantastic at just jumping in. Like they said, they came in the middle of a pandemic when things were so fluid here, and things are still fluid here because we have to change and according to, you know, what we have to do. But just having an open attitude and being flexible and adaptable to the situation that you're in is something that you have to, that's a skill that you can definitely grow in. And it's a skill that I know as an adult, I'm always working on too. So that's something that's beneficial to you as a medical professional in general. And to be able to start working on that in such a loving, caring, and friendly environment is helpful before you get to places like Ben mentioned where, you know, don't touch that, stay away, don't talk. You know, we're open to questions and open to interacting with you. And that's part of our goal, to make you comfortable in a medical field.
Yeah, thank you for sharing that. I think that was a good kind of narrative flow about that. And I think that's a good key point to bring up, is kind of what are the scholars' contributions to us as an organization, and a big part of that is learning. And I feel we'll talk a little bit more about that as we go throughout this kind of hour. So with that, Tiffany, I'm glad you jumped in because I was going to ask you to. But now I'd kind of like to maybe reframe the question a little bit. It's really good to know what you guys are doing on a day-to-day. I would like to hear from you guys, what is the actual scholar role in relation to working with everybody else on your team? Because it sounds like you're learning a lot on the fly, a lot of development on the fly, learning opportunities, learning things to do the job, but then also learning things that will help you in your future career. So what is your role in the bigger picture of working with the teams that you work with?
Yeah, so just a bit of church health history. Scholars used to be called clinical assistants, and that's basically, I think, a really good way to sum up this position is you're assisting with anything that the clinic needs. So whether that is like, you're rooming patients, like I said, because, it's a constant flow of patients, right? So as everyone's getting checked in, someone's going to be checked out. So you're constantly working with your team. And I really like the team aspect of it of, oh, okay, Jasmine's checking out this patient. I'll go check in the next patient or next two patients while she's doing that. Just that kind of flow. So you're doing a little bit of the check-in, check-out process. So you're learning that whole side of things and really getting good at bedside manner, learning how to put people at ease, because a lot of times, especially with our patients, they're kind of taught that the doctor's office is somewhere to fear, not somewhere that you go to get help, but somewhere that costs you a lot of money and oftentimes gives you bad news. So feel more comfortable and at ease in the situation. It's a big part of the job. And that's something that I think I'll definitely take from here. But then it's just getting basic medical knowledge. I don't want to speak for anyone in the webinar. Some of you might be, EMTs, nurses, something like that. But for us, like I came right out of undergrad. I had a chemistry major and I have yet to be asked to, make any organic reaction happen here. So a lot of the clinical skills that we needed. So coming in here, I've learned a lot about just working under HIPAA, working with, like I said, sterile fields, that kind of stuff. Just practicing good clinical practice. What's the basics of how to operate as a human being in a place of work that's like a clinic setting. So I would say that was kind of how I would sum up our job here.
I want to agree with Ben. It's basically just being a helping hand and just helping when needed, because every day is different. And that's what I love the most about the medical field, because nothing will ever be the same. I also want to say that I want to pick up on what Ben said. I was a public health major with a minor in bio and chem, so it's different. So on the public health side, I do see where you have the underserved communities or people who are uninsured and that need help. And another great thing is that we have the patient assistance program. So that's a program for people or patients to get medications that are cheaper than going to Walgreens or CVS or Target Pharmacy. So that's another major plus. So you learn a lot and it's very hands-on. And I agree with Tiffany, like if you put yourself out there, you'll gain and learn a lot. So that's pretty much it.
Can I say something real quick? Sorry. Just and for someone coming from a background who doesn't really know how a clinic operates, I'll just explain really quickly that we are a primary care clinic. So think about the doctor's office. If you go, they check you in, they check you out, they get your blood pressure. The person doing all of that is pretty much what Ben and Jasmine are helping to do. We train them to be almost like a medical assistant. Now, they're not giving injections and they're not drawing blood, but they can do many of the other tests that you would have done in a doctor's office. And so when you hear them say check in and check out, they are literally taking medications from patients, recording medications. They're getting your analysis on patients. They are letting the doctor know, hey, they have a fever, hey, they have chest pain, they're short of breath. So they are actively a part of our clinic workflow. So when you hear them say work on a team, they are literally on the schedule as a part of our clinic team, working closely with medical assistants and nurses.
Yeah, just piggybacking off of what Tiffany said there, it really is, you're the first person a lot of patients are seeing. And so it's, for me, as someone who finds, so many parts of the human body so interesting, a lot of times when you're doing blood pressures, you think it's like the most boring part of your job because you have to wait on the machine and no one talks and you sit in awkward silence. But sometimes you can find, I've had patients come in and it turns out they're having a cardiac episode as I'm speaking to them. And so it's been really eye-opening and interesting to see like, oh, that's what that looks like. And then you can go in and tell the providers and stuff, and you're a part of that process of getting them the help that they need and figuring out what steps need to happen next. And so, yeah, that's just something that's, again, as someone who has no clinical experience prior to this, that was anything more than shadowing, it's a really in-depth experience that you get to talk about a lot.
And one more piece on this, I would be remiss if I didn't mention this. Ben and Jasmine, now this is probably not their favorite part of the job, which is probably why it hasn't come up. But the other piece of being a scholar is getting to know how a whole clinic operates. So many times physicians or nurse practitioners come out and they are providers in their own clinic and they don't understand what the front desk does or what the people answering the phones do or how the mail gets to them. So one of the things that they help with twice a day is they are picking up all of our and sorting all of our faxes and our mail and making sure that it gets to all the right departments. They shadow in the phone room where we have 10,000 calls come in a month. Yes, that's right. And they get to see how the phone staff operate. They get to see how the front desk staff operate, and it helps them to understand the whole picture of what it takes to operate a clinic. It doesn't just take a medical assistant and a physician. It takes a whole lot more. So I think that's another piece of the team that they have access to. And that's 30 minutes of their day. Like I said, it's probably not their favorite part, but it is a part of the job that we really depend on.
Take myself off mute as I'm talking, right? So I think that's really cool, and I like how you guys kind of frame it, and so all of you kind of are, it sounds like you're talking about through your learning process. What I thought was neat, kind of Ben, what you really hit on was, it sounds like you guys are really learning the little bits of how the big picture all fits together. And so, and from my standpoint, as part of the program, I enjoy hearing that, because that's one of the things we do want you guys to kind of take away from this, because that is what, in terms of equity and perspective and culture, humility and quality care for patients anywhere, is having this level of understanding. And so that is a practice, in and of itself, of empathy, right? Empathy is a big part of what it means to be on a provider team and a health team to help health seekers. And so it sounds like you guys are learning a little bit by taking a year to walk in these shoes, to learn all the little pieces that go into really making that patient appointment. You guys are creating a better path for you to do that on a regular basis and creating those empathy habits into a professional and a personal realm for you. And so that's a really cool concept that I'm hearing you guys kind of talk about, is kind of just learning those little bits. And I do also want to echo Tiffany and then Jasmine, I think what you said was kind of getting what you put in. I tell them that as well at the beginning of the year, and I'm glad you do as well, because it's true. And so I will say, I just want to commend Ben and Jasmine for being super engaged scholars. They have worked on service projects. They have come to the learning sessions. They have been doing kind of the at-home assignments just for the sake of learning. They have reached out and worked with other scholars and have collaborated across departments and really taken on this mantle of leadership that, it's kind of amazing that our youngest employees take on, and people, are just like, yes, this is kind of the norm. We follow, scholars and let them take the lead, and it's a safe place to kind of let them do that. And so they have that guidance and that constructive feedback kind of built in. So that's really neat. I'm also really enjoying hearing about all the different people y'all are talking about. So y'all work with a very wide breadth of professionals just within church health, and that's not to name everybody in the community. So I'd really like to hear what's been a favorite kind of interaction with people at Church Health. So have you guys had like a favorite patient interaction, either something that just like fills you with joy or something that really taught you something that you could share with us?
Well, yes. So my favorite interaction so far, well, first coming in, I did not know I would deal a lot with diabetes. So I was very surprised because at the beginning, I didn't know much about diabetes. So working here has taught me a lot and how important it is. So twice a month on the second and fourth Wednesday of each month, we have the diabetes nurse clinic. I have had a chance to work with our nurse practitioner, Miss Becky, and just go in and see patients and actually, sit down and talk to them about their diabetes, what to eat, what not to eat, and educate them more about insulin and how to check their blood sugars. So just actually sitting down with the provider it just helps you to see like, okay, I can do this in the future and just, be able to not rush through the visit and just talk one-on-one with the patients. And my second thing so far would be the Suture Workshop that Ben and I participated in. That was super fun. And I didn't know, well, I have done a Suture Workshop before, but it's a pretty hard task. Once you get it, you got it. So those are my two favorite things, just being able to actually sit down with patients and talk to them and get to know them better.
Yeah, I think that would definitely be what I would echo here. So I don't have a specific patient interaction that really sticks out. Plus, HIPAA, you gotta be careful. But I think my favorite is kind of getting to be a cheerleader for patients, because you see them, especially, Jasmine's IM and I'm family practice, but we both are we work with people's primary care physicians. And so when you come in, like you'll start to see the same patient over and over again. And it's really cool when you get to see them come in, and let's say they're having a high blood pressure spell, and it's like they haven't been seen by a doctor in 3 years. They come in, their blood pressure spiked, they're not taking their medication like they should be. And our provider's like, you need to get this under control because high blood pressure is a scary thing. And you start to, treat them, but then also say, here's some lifestyle changes that really can help you because pills can only get you so far. And they come back and they're like, hey, I've cut back on smoking. And just getting to sit there and be like, hey man, that's awesome. Like keep doing it. That really it makes me happy. Just getting to do that, because a lot of times, that kind of stuff, people in their own lives might not, be like, hey, really good job cutting back on smoking or only eating one Little Debbie cake today. Like really good job. Like that's the kind of stuff that you get to do and just sit there and be like, your blood pressure's coming down, keep it up. Positive reinforcement is the best way, I think, when it comes to things like medicine. So I would say that's definitely the part that sticks out. And then for staff, actually faxes, as we call them, what Tiffany was describing where we sort faxes, it can be made fun if you use it as not a social hour. Don't spend all your time talking to people. Tiffany will find you. But if you spend a little bit of your time getting to know people, I'd say I easily know like 80 or 90% of the people's names here at Church Health. So just getting to say hi to people, especially during COVID, is like, because everyone's so spread out here, it's just really cool to get to be like, oh, hey, how's it going? Like, how are you, how are your kids? Talk, and then you get to understand, people know you know them. So then when you have to ask favors or you're not understanding something, that's always nice. So just getting to really be a part of Church Health is really fun.
Yeah, and I think I want to touch on 2 points, two things that you said, Ben. I think the positive reinforcement is good, and a good tip for anybody to take away for any relationships you have is it's good to reinforce those good behaviors and be like, why'd you eat any Twinkies at all? Or Debbie cakes. I will probably use that going home tonight, so thank you. The other is this concept of being able to go talk to people and develop those relationships. You have done that you both have done that in a very genuine way, and all the scholars do, and it's really cool that you do that. And then just what you were talking about, and I'm in a very meta frame of mind at this point, so not gonna lie, but it really does show that you're learning and seeing the bigger system of people and how we work together, and understanding that those small little hellos and goodbyes and how are your families and those relationship developmental pieces are the small gears that make us run, right? And so it's not so much, it's the system working, it's the, when the system isn't working, how are you going to go approach the guy in IT and say, hey, are you going to say, hey, how are you doing today? Come fix my stuff. Or are you going to stop and take a minute and like show appreciation? So I think it's cool just on the meta level. It shows you're learning the value of those relationships. And so I think that's good quality. Go you guys.
Can I add something? So in relation to that, I enjoy, I don't want, if someone's watching or ends up watching this, if you're a quiet person, one of my favorite moments was, or not moments, it took a little bit, but everyone doesn't come in. You can probably tell that Ben and Jasmine enjoy talking to people, and especially Ben, he has never met a stranger in life. So he just came in that way. But, you know, a couple of years ago, we had a scholar who was so sweet and so qualified. And I will never forget her trying to check in the patient, and she went to the waiting room to call the patient's name and literally just said, I'm going to make up a name, but you know, well, Jasmine Williams. It was just Jasmine Williams. And having our medical assistants or nurse, whoever was working with her, was like, no, you have to really call their name. And so we literally taught this person how to speak up and speak out, and truly how to interact. And, you know, a month in, she was good to go. So don't feel like you have to be this extrovert, extraordinary communicator. We are going to work with you when you come in. And if you're a quiet person who's not used to being around people, this is the job you need if you want to be a physician, because we are a friendly environment, and we'll teach you how to talk to people. So anyway, that's one of my favorite things, is just watching people come out of this little shell and just expand and be a wonderful person.
Yeah, I want to agree with Tiffany. So I think I was kind of the same way. I was very quiet. Well, I don't want to say very quiet, but I was kind of shy in the beginning, and Ben was so outgoing. I'm like, this this person is very, you know, kind of crazy. But I think it's a perfect match, because he's more outgoing and I'm more just quiet and just, you know, nice and sweet to everybody. And, you know, once I got to know everybody, I was able to open up, and, you know, I enjoy working with everyone. So I think Ben and I are the perfect match this year somehow.
I would completely agree.
Everybody just started at once. Go, all right, everyone.
But it's also just, I just wanted to tell people, if you are, you know, a little bit scared, like I was a little bit nervous too. Like I can talk to people, but I was also like, I don't know what I'm doing. So a lot of times, like when you are going out there, you're never like, someone is with you. Like you shadow an MA for at least, I think I did like 2-3 days of shadowing an MA and one of our old scholars, just seeing what the check-in process is like, seeing what the checkout process is like. You get familiar with our software, you start to learn the questions to ask. And then when you start doing it yourself, they shadow you. So an MA will be there with you to be like, hey, just, you know, real quick, you should ask them X, Y, Z, you know. And none of our patients were ever like, are you like, what's going on? Like, why is there another person here? It is totally a very welcoming environment from all sides. They just want you to do what's best for the patient. So you won't be just thrown out, you know, sink or swim junior, see what happens. It's really like they work hard to make sure that you're prepared, and that really shows. So then you're more confident when you go out and talk to people.
Alan, you're on mute.
I am mute. Thank you, Tiffany. No, I'm loving this. I'm loving the dialogue and the conversation. So thank you guys. The energy is really good. I do want to switch gears a little bit because you guys are talking a lot about what you're learning on the job and learning hands-on and kind of what this real world experience is like. But I also don't want to discount what you guys have learned and prepared for, right? Because you guys have been not necessarily prepping for church health your entire lives, but you know, for the last 4 years of college, you've been prepping, looking, going to med school. So how do you feel that your school and your experiences before church health prepared you for church health, and how are they helping you now?
Yeah, so I guess I'll go first. So just in school, I did a lot of extracurricular activities like that just prepared me for random events happening, just working on the fly, lots of service projects that had like shoestring budgets. So it's like, how are we going to make this work? That kind of stuff, which is not the case at Church Health. Everything is very rarely that we don't have what we need. We've got an abundance, but it's a lot of that, like just learning to adapt and being flexible. And like when a plan starts to fall apart, being like, all right, cool, we're just going to rebuild it a different way. So that's something that really prepared me to be here. And then, I think a big thing to tell yourself is if you're nervous about learning all these different things, if you can learn, like get through organic chemistry and chemistry, you're going to be fine. You can make it through here. Everyone's here to teach you. So I would say just your schooling has showed you that you can learn a lot of material and you can learn it in depth. And then if you, like for me, when I did my extracurriculars, I was able to learn, I can adjust, I can be flexible.
Yes, and I would say, I guess having leadership skills, like you don't have to be the president of your club back in undergrad, just being able to complete tasks and being prompt. And I would say being a great communicator with everyone, especially the charge nurses, the medical assistants. And I think that's about it. Just be yourself and just learn everything that you can.
One thing that to piggyback off of what y'all said that I know that I look for in applicants, because I feel like what I look for in an applicant is someone that I feel like is going to be a good fit for medical school and to be a doctor or a nurse practitioner, or, to be a leader. We're training medical leaders. And so I look for people who are compassionate, have are good communicators, but obviously I've already said we're going to build on that. But I look for people who are accountable and who are independent and want to, do the next thing. And you don't have to always tell people what the next thing is. And so Jasmine and Ben do a great job of just, they've picked up on what the daily stuff is. And they just go with it. And the time that they're not, they are cheering on. They really are cheerleaders for the rest of the staff. Both of them are in their own special ways. So anyway, looking for people who are going to, be accountable to their actions and treat people with empathy. Those are the things that I'm looking for.
Cool. So thank you for sharing and jumping in, Tiffany. So I'd also like to hear from you, Ben and Jasmine, because again, you're talking about a lot of your daily experiences and what you're learning from those and the people around you. And then of course, being the cheerleader, I like that. And that definitely fits you two. You guys make a good pair for that, most definitely. But what else have you guys done during your time at Church Health? I know you guys are 40 hours a week, full-time employees, right? All the scholars are part of being a scholar. There's like this a little bit, we expect a little bit more from you guys, and we have that whether programming, other opportunities to engage with staff. And so what does that look like for you guys? It's okay, take a minute to think about it.
I guess I can go. So yeah, some of the outside stuff that's really cool is if you happen to see my day in the life of a scholar, I kind of mentioned it, the professional development side is really something that's not just, they don't just say professional development is in like, oh, well, you'll be here, you'll learn how to be a professional. They also sit down and say like we had a full, I think, month and a half where we had these things called lunch and learns, or chat and choose. That's what it was, chat and choose with Josh. We'd get together outside at Church Health, spread out social distance, and just have our lunch together and just chat about, how to be a provider that cares for people in every way, different things like that, or what's your calling and who are you? I think one of my favorite ones was who are you being held accountable to, and that was really interesting, like both now and later. So yeah, you talk about that kind of stuff. I was lucky enough that I got to run a service project with the local Green Line here. That was another thing that I held near and dear. I did a lot of service in undergrad, and it's something that I want to carry over into my life. So this was just another chance to, you can never be, perfect at planning an event. So it's just another chance to practice working with a community partner and working with people here at Church Health to better your community.
And yes, I agree with Ben. There are a lot of connections here at Church Health, and I appreciate Alan and all of the sit down sessions we have had with Josh and just meeting everyone. I will also say we have the ability to sit down with Dr. Morris, who is the CEO and founder of Church Health, and just being able to connect with him and talk to him about medical school or, PA school or any field that you are interested in. He has a lot of advice. And even if you're embarrassed to talk about anything, I go in there all the time without an appointment to meet with him, like, hey, I need to talk to you. And he's very sweet and helping. And well, I would first like to say I had started working out with him like every Monday through Friday. I work with him and check in patients. So that's how that relationship started. So it's a lot of connections, and just be willing to talk to anybody and don't be shy or embarrassed if you have all of these things going on, because everyone here is willing to help.
Yeah.
Oh, sorry.
Oh, you're good. Do you want to go, Tiffany?
Well, I was just going to say that there's also, I don't think y'all have hit it yet, but Alan sets up this whole med school interview, mock med school interview, and people who do the interviews are helping to, there's a whole afternoon set aside to help scholars practice doing med school interviews. They do resume building. So, I mean, I would consider the program, highly applicable to going into med school and getting what you need.
Yeah, I was just going to say, please, no one who works at Church Health tell Dr. Morris that I didn't mention his meetings with us. So what Jasmine was saying is so true. He will go through your full application with you and be like, this is really good. They're going to ask you about this. Be prepared to expand. Here's some things like, while you're here, what can we do to make you better as an applicant when you're applying? So you can send update letters. He's there to give you advice like on update letters. Like, that's a big thing. A lot of people are like, should we send them? Does it seem desperate? Is it annoying to them? Are they going to be like, this guy's kind of crazy, we don't know if we want that? He's really good about just putting you at ease about the whole process because it is so stressful. And then he'll sit there and walk through with you on just some basic interview questions to be prepared for, how to make the best of your response, how to refine it down to a truth so that you can give it in both an elevator pitch and a 25-minute speech. But most of the time you need the elevator pitch for a shorter interview.
Right.
And he's there to cheer for you. And it's really cool to see someone who is so known throughout the community, is such a great physician, sit there and like still get so excited for people who are just going into the field. So that's something that is really, I think you can't really put a price tag on that knowledge, because he's done this for thousands of students and gotten them into medical school. So that type of in-depth expertise from someone who cares so much about getting you in and helping you in every way that he can, that's really awesome.
Right. Yeah. And so I'm glad you guys brought up that relationship with Dr. Morris. So not all the scholars will work as hands-on with Dr. Morris, as like Jasmine, you've mentioned, but they all do have a relationship with him. And so that is part of our professional development, is they all have the opportunity to sit down with him. Like y'all are talking about, either help with interviews. I know he helps with personal statements as well. And so I want to address a little bit of what Tiffany was talking about. But Jasmine, it looked like you wanted to say something as well. And I know you've gone through some of the professional development stuff. So did you want to share something before we kind of go into that?
Oh yeah, so speaking of mock interviews, like Tiffany said, I actually have my mock interview today at 2:00. So
yeah.
Yeah, so it's not just
I wasn't going to bring that up, but I can't.
Yeah. Yeah, so it's not just something that we just say like, hey, we have mock interviews. So like everything that we say is true, and it holds us accountable and make sure that we are prepared for, the next step after the scholar program. So I'm excited for that, kind of nervous about the mock interview, but I think I'll be fine.
Right. Yeah. And especially with all the practice, it does help. And then so I'll add into it, because some of you guys may have already been beyond this point or not there. But one of the things that we offer to all the scholars is, you can sit down with anybody on our administration team. We got about 7 staff members who help run the program, just providing different perspectives from everything from faith to clinic to, our development and communications. And so, we have a group of folks who you all have the ability to say, hey, can somebody check out my resume? Can they help me with my letters? And usually toward the end of the year, when people are going more for grad school, I'll get a lot of, hey, can you sit down with me and go over my letters and my personal statements? And I mean, that's something that we have, we have a team to do that, but then Dr. Moore sits down with you and does that as well. And I think that's really neat that he does take the time to develop that relationship with each of you. And just to rephrase a line from earlier to make sure we're clear, to help students get into medical school. So with that, I know our hour, we got about 15 minutes left, and I want to be respectful of all of our time. So I really like, you guys have been talking about what you're learning the entire hour, and so I'm not going to dive a little bit into that. But I'd like to hear from Tiffany actually on this one, and you've kind of alluded to a lot of these different pieces. But what value do the scholars bring to the work of your area and to the mission of church health? So like, what value are they bringing to us? I mean, it sounds like they're getting a lot of this experience. You've talked a little bit about their flexibility and their learning. Jasmine and Ben, I'd also like to hear you guys and your take on this, but I'd like Tiffany to kind of open up that discussion.
That's an easy one. It's hard to put into words the value that the scholars bring to the organization to me. I'll speak specifically to the medical clinic scholars. We used to have 6 or 7, now we only have 2. But I can say, honestly, watching each scholar year move through, that the value they bring is there's an energy there that they have. We could easily fill their positions and get another medical assistant to do the job that they are doing. But everyone at Church Health believes in the power of mentoring and growing, and the scholars bring such a young energy to us. It's palpable when you go into the clinic. It's every summer when we switch scholars, the medical assistants and nurses are excited about new scholars coming. All of us love being able to, kind of hold their hand for a minute, not literally, but, kind of walk them through the process and watch them grow. It's just an amazing thing to watch. And they bring an energy that is, the energy that they bring, I would say, is probably one of the best things, because they're ready to go. They're ready to volunteer. They're ready to serve the community. They're ready to serve our patients. And I think that it's a real boost to our staff, especially this year has been a really difficult year, as you can imagine, in a medical clinic with the pandemic, and we're tired and don't know when it's going to end. But, this summer, the scholars came in and they were ready to go. Just tell me what to do, tell me where to go. And so just having that visible energy and love for others and ready to serve in a community that doesn't get much service is the best thing in the world to me. I love working with the scholars every single year. I hate to see them go. Every year they're the best year. It's hard to put into words. Yeah, Ben thinks that he's the best one this year, but he just. But anyway, that's the only words I can say is it's hard to put into words, but they're just fantastic. There's another group of scholars that work with our specialty clinics, and it's the same thing. We have to teach these guys a lot, but it's worth it every single year. I wouldn't train how we train every year if it wasn't worth it.
Yeah, there's definitely a lot of, I know, time and resources invested into training our scholars and getting them up to speed. So it's always kind of fun to see that, there's this couple weeks of shock where they're all like, oh, wow, all the stuff I did learn in school is important, but there's all this other stuff that I had no idea I didn't know, right? And so suddenly they feel like they're in the deep end, but they're, we got them. So Jasmine, Ben, I'd like you to share any thoughts that you might have on that, or your own thoughts about the question about kind of what's the value that the scholars bring to our staff and bring to our areas and our work.
Well, I would say, I guess being able to fill in, because let's say if a medical assistant or a nurse is not here, so we have the ability to still help out in clinic. And well, I would say the first 3 weeks to me were I guess, challenging because we're new and we didn't know a lot. So it was kind of nervous, or it was kind of, I don't want to say it was hard, but we had to take notes and actually grasp everything because your scholar from the year before trains you. And after that, you're kind of, I don't want to say you're on your own, so I'm not going to say that, but we do have people to help. So you just have to be willing to learn and catch on and, just, I guess, soak everything in.
No, yeah, I think there's definitely some energy that's added to the community, but it's also so cool that, I don't know, just if you're looking at adding value to the organization, that kind of stuff, I think what's really cool is the flexibility of this position that's like written into what we do is really nice. Because, this is just like any other job. Someone's going to be sick, or their kid's going to be sick, or, flat tire on the way to work, and you got to cover for them. So that flexibility is really nice. But it also comes out good for you because when stuff happens like drive-through testing that we're doing, that kind of stuff, they can be like, hey, do you want to go out here and do this? And it all comes back to getting you ready to go on to that next step. Everyone here understands that. And it was really cool for me, at least, when I was doing my interview, they were asking, so you did COVID drive-through testing? And I was like, yep, worked with running the site, was there at 6 a.m. every day. We no longer do that at 7:30 now. So some of you who are not early birds, you'll be fine. But yeah, you'd come in and we would get things ready to roll. So that's really cool that we're able to help the organization keep running in times when there's literally a global pandemic and, people are still in our own staff having exposures, or, they're feeling a little bit under the weather that day or something. So that kind of flexibility, I think, is something that we definitely add to the setting.
Completely agree, Ben. I was trying to think of other things aside from just the fact that you all fill in all of the various holes that we have, from answering a phone to drive through to checking a patient in or out. But yes, the flexibility that you guys have done is great.
Right. And I'll kind of echo that. I think the way that you guys kind of describe it, I think Tiffany, the way you described his energy is kind of neat. You guys have really described and kind of painted this picture of y'all's roles. Tiffany, like you said, kind of filling in the holes, which I think is neat. But again, I feel like that enables you to have connections all over the clinic. And as a whole, your role is to help us run more fluidly and more smoothly and streamlined. And you guys do that. And so it's not just these one or two little places where you fill in holes. It's you guys take up the things that are new and innovative, and you're leading the charge. And that's one of the reasons that staff do tend to look for scholars for leadership, even at such young ages, is because you are picking up these heavy loads, these new scary things like designing and doing the COVID testing and all those pieces. And our scholars, go on to do that kind of work. And we have several on staff who continue to help us with that, right? So I think that's cool. And I'm glad that you bring that up. So I want to close. So it looks like we're running short on time. So I'd like to ask you guys just one more question. And then I don't think we're gonna have time to go through the application, but I'll show everybody where to find it. And we have past recordings that will have the same information that we can throw in here. So I'll do that. So I just want to ask everybody really quick. Y'all have been great, but final question is, what advice would you give to any students who are interested in the Scholars Program?
Just do it. Just apply for it. It's a great program. If you're someone so a little bit of my story, last year I was applying my senior year of college, did not get accepted. And so I was kind of telling them like, hey guys, I don't fully know. And they're like, yeah, it's fine. Like that happens every year. Like we'll be fine. Like you just do what you got to do for you. So if that's you, definitely don't even hesitate. Still hit the apply button, because, if you're awesome and you get accepted, here, and then you also get accepted to med school, Alan, and I think I talked to Tiffany a little bit about it too. I was like, I still don't know anything. And they're like, yeah, it's fine. Just, when you hear, let us know, like you'll be fine. And so that's always really cool that they're also flexible with you. So if that's something that's worrying you, don't even let that cause your brow to wrinkle at all. Like, that's nothing bad. And then also just, come into it and be ready to learn, I would say is probably the best thing, is just come in and know that this is, gets you that nice, huge amount of clinical hours that you can put onto your AMCAS or ACOMAS application. But it also really, really, really helps you just become a healthcare professional and get ready for what the rest of your life's going to be like.
I appreciate you bringing up that the program flexibility and working with you and other students, and that made such an impact for you. That was something that working with supervisors we had developed over the past couple of years to try. So that flexibility is very intentional. We have tried to make sure that is part of our process for the applications, because we know that people are applying to 3, 4, 5, 6 different places, including us. Some are med school, some might be other positions or programs. And so we get that, and we try to be flexible with that and work with everybody. So yeah. Others, I'd love to invite Jasmine and Tiffany as well.
Yes, so I agree with Ben. So if you're looking to find like a fellowship or some type of gap year internship, I would say go ahead and apply. And like Ben said, well, it's my first time applying to med school this year. So I have no idea what I'm doing. So I ask Ben all the time for, questions. If I have questions, I ask for advice. So don't be afraid, because I was very afraid to apply to this program because I knew from the start it was going to be competitive. So when Alan called and told me I got it and I was accepted, I was like so excited. Like I didn't even know what to do with myself. So I would say just go ahead and apply and don't hesitate. And if you do get accepted, I would say enjoy every second, because this internship, we're in December and it ends in June. I don't want to leave. So I would say enjoy every moment and, get to know people and just be in the moment, because it goes by so fast. So that's all that I have to say.
Thanks, guys. I would say, like Ben, if you're even considering this, then go ahead and apply. It doesn't hurt to apply. We do look at resumes and consider whether, you're a candidate. We don't accept people with 2.0 GPAs or anything like that. We are looking for people that are looking to go seriously into med school. But it's not all about what's on that piece of paper. I know that there are several other managers that interview the same way I do, but I specifically look for people who have the heart for serving the underserved. And if you have the heart to serve people who don't have access to healthcare, can't go to the dentist, can't go to the doctor, this is a place for you. And if you're just looking at this as a stepping stone and a way to kind of get into med school a little bit easier, it's really not the place. I know we've had a great interview and a great time, and I don't want to end on that at all, but we are really looking for people who want to serve in their community and serve this population moving forward. And if that's what you're looking for, then you definitely need to apply. I'm excited about the next group and look forward to seeing who is out there and who's watching and who wants to come join us.
Tiffany, I don't think I could have offered or extended an invitation any better than that. If you are looking for a place, then we are here. So with that, I think we'll go ahead and end this call. If you are interested in the program, please feel free to reach out to me at leboa, that is LEBOA @churchhealth.org, or visit us at churchhealth.org/scholars, and our applications will close on February 15th. So thank you very much, everybody. I will talk to you three later. Thank you very much, and have a good rest of the weekend. Bye, everyone.
See you guys.